Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us is Dr. Robert Popovian in Washington, D.C. He's a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me, as always, is my good friend, Ben Blanc, dialing in from Indianapolis, Indiana. Ben is our Director of Digital Production and Engagement. Ben, how's it going? Seems like it's never a dull moment with this administration regarding healthcare these days.
You're right, Robert. There's definitely a lot happening. And lately, there's been a lot of talk about what the future of health policy might look like, especially with some key appointments by the new administration, like the recent nomination of RFK Jr. as Secretary of Health and Human Services.
Clearly, his nomination has garnered a great deal of attention. His perspectives could influence healthcare policy for near future and for years to come. So it's very important for us to have this discussion today about what the impact of this administration will be or may be on vaccine policies moving forward.
A lot to unpack here, for sure. And speaking of vaccination policies, Robert, you recently co-authored a new report on Pharmacists' Vaccination Authority with our two guests today, Vibhu Tewary, Project Director at the IQVIA Institute for Human Data Science, and Conrad Bhamani, Thought Leadership Manager, also at the IQVIA Institute. They'll be joining us to break down the key findings of the report and discuss how state policies are impacting vaccine access across the country. There's lots to discuss, so let's get to it. Today we're exploring how state rules limiting pharmacists' vaccination authority may be stopping millions of adults from getting important vaccines like those for RSV, pneumonia, and shingles. A new report from GHLF and the IQVIA Institute for Human Data Science, released just last week, shows that states with more restrictions see lower vaccination rates. So, in today's episode, we'll break down the key findings, discuss why pharmacists play such a crucial role in vaccine access, and explore how changing these policies could help more people stay protected. Hi Vibhu, hi Conrad, thanks so much for joining us today.
Hi Ben, nice to be back here with you and Robert.
Hi Ben, hi Robert, thank you for having me.
So before we dive into today's discussion, let's start with the big picture. Robert, pharmacists are often the most accessible healthcare professionals, especially in local communities. Can you explain why their role in vaccination is so important and how these state-by-state restrictions create barriers for patients?
Thanks, Ben. I mean, we've talked about this on multiple occasions on our podcast. You know, pharmacists are the most accessible healthcare professional in the U.S. About 80% of the U.S. population lives within 5-mile radius of a pharmacy. In fact, there are more pharmacies in the United States than there are Starbuckses, if you can imagine that, because it seems like there's a Starbucks in every corner. So how are they impacting vaccinations? Well, there's ample data available that, one, patients prefer going to a pharmacist for immunization. We've done other research with IQVIA in the past that shows that patients actually end up going to a pharmacy, adult patients, to get the majority of their vaccines done. The second part is that beyond being accessible, they're also where the communities that need them most are. The pharmacists are far more accessible in poor communities than physician practices that actually immunize. And lastly, previous report that we published in GHLF last year, co-authored by myself and Wayne Weingarten, explored what is the cost of basically having these restrictive policies in the states that prohibit pharmacists to be able to immunize on par with their physician peers. We estimated what the cost will be from a legislative standpoint. To go through a legislative process every time costs money. What is the cost to patients regarding accessing these medicines or vaccines? Lower immunization rates? What are the complications that occur? What are the morbidity and mortality rates? But one of the things that we didn't look at and we tried to do with this paper is actually what is the impact, the real impact? And this is where our paper comes in and our partnership with IQVIA comes in regarding looking at this important topic.
Thanks, Robert. That really highlights why pharmacists are key to increasing vaccine access. So now let's take a look at what the data reveals. And by the way, to our listeners, we'll drop a link to the full report in the episode description. So, Conrad, I'm turning to you. One of the biggest takeaways from the report is how state policies can affect vaccination rates. For example, we see in the report that states where pharmacists need a doctor's prescription for RSV vaccines had a 14% lower vaccination rate than states that allowed pharmacists to vaccinate indefinitely, and states requiring a physician protocol saw a 9% lower rate. Can you walk us through why these restrictions lead to fewer vaccinations? And can you talk a little bit more about the findings of this report?
Absolutely. So I'll speak to why these restrictions lead to fewer vaccinations. Of course, as Robert mentioned, the vast majority of Americans see that pharmacists or pharmacies are the most accessible healthcare professionals for them. And especially in our report with GHLF in 2023, we saw that 90% of vaccinations for the COVID vaccines occurred in pharmacies from 2021 to 2022. During flu season, about 60% of flu vaccines and about 40 to 50% of pneumococcal vaccines occur at pharmacies as well. That being said, vaccination rates tend to be lower than targets in general, and any sort of barriers to vaccination should be minimized if possible. In terms of what we saw in our report, as you mentioned, we compare vaccination rates for states where independent pharmacist administration is allowed compared to states that have protocols and prescription requirements. So first of all, a protocol is an agreement with pharmacists and a specific physician to administer vaccines to patients only when this authorization is in place. So this is considered more restrictive than independent administration by pharmacists because it relies on that standing agreement with the physician in order to administer those vaccines to a specific group of patients. Now, more restrictive than a protocol agreement is a prescription requirement. So this requires that there be a prescription from a healthcare provider to the pharmacist for one specific patient and one specific vaccine. Now, there are certainly a variety of factors that can impact vaccination rates, personal beliefs, etc. But overall, we did see that 9% lower vaccination rate for states with a physician protocol compared to states where independent vaccination was allowed, and a 14% lower vaccination rate for states where a prescription is required across all three of the vaccines that we studied in this report.
Thanks, Conrad. And you've alluded to it, but let's talk a little more about how these findings play out in real life. Vibhu, when we talk about state restrictions, it's not just about numbers, it's about real people who face obstacles in getting vaccinated. So, from the data you analyzed, what stood out most to you about how these policies impact patient access and pharmacist workflows, especially in underserved communities?
Yeah, thank you, Ben. I think Conrad summarized the data really well, but you're right. At the end of the day, I think it's important to think about who are the people that would be impacted by any restrictions on pharmacies, who are the people who would actually be accessing these pharmacies. Robert already laid out some of the key statistics. Pharmacists are the most accessible healthcare professional. Pharmacists and pharmacies are more accessible in low-income communities than physician practices, especially when hours of operations are concerned. So these are really people who may not easily be able to go to a physician during typical work hours. They might lack flexible work schedules. They can't take time off during regular work hours, which is when the physician offices tend to be open. And racial and ethnic minorities tend to be overrepresented in these groups and low-income communities, which often makes immunization access through a pharmacist essential for them to actually able to get a vaccine and address some of the health disparities that already exist. I think in that context, this whole research is really important. Even in our earlier report from 2023, we found that while a large majority of adults anyway get their vaccines from pharmacy settings, this is particularly true in the Hispanic community. So there's definitely, if you're just thinking about people, this is a crucial point where people are getting vaccines. And in that context, there are already so many barriers to getting vaccination, whether they're structural, economic, cultural, and so on. And as Conrad mentioned, adult vaccination rates remain fairly low. Any efforts to improve access to pharmacies, reduce the burden on pharmacists to actually be able to administer these vaccines would be helpful, particularly helpful for these underserved communities. So I think from that perspective, thinking about the pharmacist workflow and the impact that these policies can have and the importance that these spaces have for different communities, it's definitely a policy topic that requires more discussion and more focus.
Thanks. That definitely paints a compelling picture of the challenges on the ground. So now let's shift to what can be done to change this. Robert, based on these findings, what are some policy changes that could make a real difference in allowing pharmacists to help more people get vaccinated?
So the policy changes have to be on the state level because, as we've discussed previously, practice of pharmacy, practice of medicine, practice of nursing, any kind of healthcare professional is managed through the state level. It's not a federal issue. This is something that every state needs to take on, and that's what we looked at. We looked at state by state sort of barriers. I believe that the ultimate answer is to get to a point that physicians, pharmacists are on par with regards to their ability to immunize patients. That if the FDA has approved the vaccine, physicians can then immunize the patients. Similar, the pharmacist should be able to immunize patients as well. It's great to have a CDC recommendation and so on, but that's not necessarily the need. Now, that's panacea. That's something that we need to get to eventually. But I think there are incremental steps that we can take from a policy perspective to get to that point. For example, you mentioned, Conrad talked about it, prescriptions. Do you really necessarily need a prescription to get a shingles vaccine or an RSV vaccine in a state? And if a state mandates that, can they get rid of it? And it's more of a subtle regulatory change that will improve access. Because think about it, if you're a patient and you have to go to a physician to get the prescription because the physician doesn't carry the RSV vaccine or the shingles vaccine, and then have to go to a pharmacy to get those immunizations done, the likelihood is that you're not going to follow through. So we want the ultimate goal to be equal access or equal ability of pharmacists to immunize on par with physicians. But meanwhile, we can make incremental changes and improvements in the states. For example, remove the prescription barrier. For example, remove the physician-based protocol barrier, which in my opinion is really hard on independent pharmacies. They just don't have the bandwidth to be able to have all these different agreements with physicians in the community to immunize their patients. So things like that will help go a long way in ability of pharmacists to immunize. And as Vibhu has stated, I've stated in the past, Conrad talked about it. Look, patients want to go to a pharmacy. Pharmacies are more accessible in underserved communities. And by improving this access points and ability of pharmacists to immunize, you're just going to get to a point that there's equal access to healthcare among patients and better healthcare overall as they have better immunization rates.
Thanks, Robert. Well, policy is definitely one side of the coin, but what about the day-to-day realities pharmacists face? Robert, as a pharmacist, you know the practical challenges of providing vaccines in community settings. So, beyond policy reform, what practical changes would help pharmacists overcome everyday barriers to vaccination, especially in rural and underserved areas?
I think it's partnership with their physician colleagues, understanding what their dynamics are in that community with regards to accessibility of vaccines to ensure that the physicians are referring the patient to them, because a lot of times patients show up, and it happens to me. My annual visit, I go to my primary care. He says, "Have you gotten your shingles vaccine?" And I say, "No." And he said, "Okay, you need to go get your shingles vaccine." So what I need to do is to go to a pharmacy to get it because he's not carrying it. I've asked them that multiple times. So to have a relationship with these physicians, to be able to then have a relationship with their policymakers, to really paint for them a picture of how these barriers, such as a prescription, such as having individual protocols with physicians, really hinders their ability to serve their patients. So from a practical solution, they just need to get involved in the process and voice their opinion, not go back into their shell and say, well, I can't do it. I'm not going to bother doing it. I'm going to do something else. No, immunization is super important. They have an access point that is very important for patients, and they need to take it upon themselves to improve the legislative environment, policy environment, regulatory environment, so patients have better access to immunization, and especially immunization through the pharmacies that they prefer.
All right, so let's now zoom out and consider how data can guide future decisions. So based on the data in this report, are there any trends that point to successful approaches states have taken to improve vaccination rates? What can other states learn from these examples? Vibhu, do you want to take this one?
Yeah, I can take this one. So I think I'll start with a caveat. We're looking at averages in our report. So there's obviously a little bit of variation. There's some states which are independent, which may not have high vaccination rates compared to some other states which have prescription or protocol requirements. But clearly the main learning here is that on average, in general, there is a trend which suggests that having more independence for pharmacists could potentially increase vaccination rates. I think is pretty much the headline there. I also think beyond this research, there's scope for more learning across states. There's a number of states which have had these kind of independent ability for pharmacists for a while. They could serve as best practices in case studies. They can help address any concerns that other states might have in moving to this more independent kind of system. I also think even in terms of the study, making it more robust, considering other factors which impact vaccination, to really further highlight what is statistically the impact of these policies will be important. And I think taking all of these learnings together, really policymaking should be utilizing this data to make decisions and push for better, meaningful outcomes for patients. So I think that's where I would lean towards in terms of learnings from different states.
Well, thank you both. Thank you, Vibhu. Thank you, Conrad, for all of your insights. Along with Robert, you really did a fantastic job breaking down the key findings of this newly released GHLF IQVIA Institute report. And just a reminder for our listeners, we'll include a link to the full report in the episode description. So, my big takeaway from today's episode is this. Pharmacists are a critical part of improving vaccine access, especially for high-risk and older adults. But state restrictions, like requiring physician prescriptions or protocols, can lower vaccination rates, leading to millions of missed opportunities for protection. Now, expanding pharmacists' authority could be a game changer in closing these gaps and protecting more people. But I'm not the expert, so Robert, you have the last word.
Well, first of all, I want to thank Vibhu and Conrad for their partnership. This has been a long-going endeavor with GHLF and IQVIA Human Data Sciences Institute. We continue to do work with them, and we hope to do even more work, not only in the vaccine space, but other spaces regarding healthcare policy and the impact on patients. My takeaway for all of this is, look, we have an environment right now where there are school closures because of flu outbreaks in the state of Texas. Same in the state of Texas, there's over 100 cases of not confirmed measles going on. Vaccination saves lives. It reduces mortality, morbidity. No matter what policymakers talk about, vaccination works. Now, we can all have a debate about natural immunity, but the problem with natural immunity is that for you to be able to gain natural immunity, you actually have to get sick and go through that sickness. And as we learned with COVID, not a lot of people survive at the back end. So we are taking a chance, especially with our vulnerable patients. So an environment that we currently have where there's outbreaks going on all over the country regarding flu or in measles in case of Texas and other states, in an environment where people have doubts about vaccines, where we have policymakers, healthcare professionals, and healthcare leaders that are promoting not vaccinating patients, we need to think really hard and think about what can we do to help. And one of the ways to help is to allow pharmacists to immunize more often, much more freely, and at the end of the day, if a patient chooses to get vaccinated, they should have access point that is unhindered to them.
Thanks for breaking that down for us, Robert. And that wraps up today's episode. Don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends. It'll help more people like you find us.
And if you have any questions, thoughts, suggestions, comments, any thoughts about any future policy issues you want to hear from both Ben and I, from Vibhu or Conrad, we can always get them back on doing this podcast. Please send an email to podcast@ghlf.org. And if you have a great idea, we may even invite you to come on and have this debate and discussion with us. Look, we're at a critical time in our country. We have a lot of changes going on. And the more we talk about it and debate and open and freely without the fear of consequences, it will be better for patients. And that's what we're here for. We're here for patients. Without patients, none of us will be around. So please reach out to us anytime you want.
And before you go, make sure to take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Ben Blanc. We'll all see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.